Good evening to all our participants, and thank you for joining tonight's webinar. Before we officially start our webinar, we would like to call on Dr. Alvin Marcelo.
Yes, thank you, Charisse. I think people are still trickling in, so maybe let's wait for another 3 minutes. And during those 3 minutes, I'd like to
Hello.
just acknowledge
Thì là
the
cái này chỉ
participants
thì
in the call. I think I
em bên
shared
người
Dr.
này thì đây cục
Yeah, Charisse, can you mute
Yes,
Dr. Bunchai first? Yeah,
tổng tăng lên.
can you do that?
we'll find this account.
Dr. Bunchai, can you mute your microphone first? Thank you. Okay, so we have a few new names. We have a few new names. Alicia, welcome. Tish, Athena, we haven't started yet. We're waiting for some people to still log in. Usually, we found out that when we say 9 o'clock, it's 9 o'clock when they start opening their mobile phones and laptops. So it may take some time before they come in. Oh, there's a question from Dr. Fazila. Yes, Dr. Fazila. Do you have a question, Dr. Fazila?
Sorry, Alvin, can you hear me? Hello?
Yes, we're on broadcast now.
Oh, okay. No,
Yes, we are on broadcast now.
Okay, but no, I can't see the attendee's name like before. We know who's on board, but how come this one we can't see?
This is the webinar. So this is for 500 people. Yeah, so it's a different interface.
Okay, all right.
Yes. So only for the go-to webinar, only the organizers are able to see the names of the participants because of privacy reasons and policy. But in the GoToMeeting version that we also have, which we use for our smaller meetings, community of practice meetings, we will be able to see the names of everyone. So I'm just calling out names. I see them. Don't fault me if I don't call your name yet. But some people that I recognize are Dr. Gabriel Borlongan, Carl is here, Rodman, uh, Lauren Walters, Michelle Zera, Pradeep Balchandran, Ronwil Cornell. Hi, Ronwil. Rose Ann Duniga, Sanjay Podel, Sarah Shining, Siddharth Srivastava, Vijay Andragavan, Victoria Rabovskaya, Ismail Zuniga, and I was scroll up. Dr. Fazila, Daniel Futterman, Athena Husnain, Anissa Ristia Ramanti, Anis Fuad, who I'll call later, Alicia Spengler, and Atish Neapani. And I asked Charisse to announce a 3-minute waiting period. I don't know if we've reached that time already. Charisse?
Dr. Alvin.
Have we reached the 3-minute waiting period already?
Yes, Doctor.
Okay, sige, go. We'll start.
All right, Dr. Alvin, for our participants, please be reminded that throughout the meeting. For comments, please use the chat box. We can assist you. And for questions, please use the questions box. Before we start, we want to introduce speakers. So our first speaker is Dr. Alvin Marcelo. He is the Executive Director of the Asia eHealth Information Network and the Managing Director of the Standards and Interoperability Lab Asia. He is also the Vice President and Head for Information Management Group and Chief Medical Information Officer at St. Luke's Medical Center. He is also certified in CGEIT, TOGAF, Archimate, and COVID-5. The second part of our webinar will be led by Mr. Saurav Bataray, who is the Deputy Advisor of GIZ's support to the health sector program in Nepal, where he leads the team on health information systems, a team that focuses on providing support to the Ministry of Health and Population in Nepal to strengthen its routine information systems. Among the many information systems supported through the GIZ program is OpenIMIS. Mr. Saraf has been directly involved in the deployment of OpenIMIS in Nepal since 2014, starting from the initial customizations required to fit the Nepali context to its nationwide implementation and capacity development of users. Currently, he is also supporting the OpenIMIS initiative in its efforts to develop the OpenIMIS software further and to build a community of practitioners around it. First, we now call on Alvin Marcelo.
Thank you, Charisse. Thank you, everyone, for joining our call tonight. I chatted that I don't see Saurabh, so I also asked Charisse to. Oh, okay. So Saurabh is already here. Thank you. Good evening, everyone. This is our 109th AeHIN Hour. For those who have been participating since the beginning, thank you very much. For those who are just participating tonight, welcome to our 109th. As a matter of fact, when we started this way back in 2012, when we were still under the World Health Organization, we didn't know that the way the AeHIN Hour sessions would be conducted would be propagated in so many different ways. So right now we have the University of the Philippines College of Medicine who are conducting their own webinars using this same platform, and they have been hugely successful, much more successful than AeHIN actually. Now conducting at least two webinars per week, not on e-health, but on healthcare and medicine in general. So for tonight, I am honored to be presenting together with Saurabh our webinar on OpenIMIS. We're calling it OpenIMIS 101, launching the community of practice. And I divided my presentation um, into the following: a quick, brief introduction on OpenIMIS, and I appreciate if Saurabh can add more flesh later on when it's his turn. Some context why we are discussing OpenIMIS in the Asia eHealth Information Network. Then some context about how we see OpenIMIS' role will be in strengthening the Asia eHealth Information Network. Demonstration and walkthrough by Saurabh on some of the main features of OpenIMIS. Not very comprehensive because we can have another session for the details, but just enough for the audience to understand what the software is all about. And then I'll come back and discuss some of the plans of AeHIN for 2019. Because I see some new names in the list of participants like Ronwin, I'll just give a brief statement about AeHIN or the Asia eHealth Information Network. So way back in 2011, WHO gathered Asian country representatives from the ministries of health in Vietnam, and the topic was health information systems interoperability. And the 3-day conference in Vietnam ended with basically the agreement of the MOH representatives that there was really no interoperability happening, even within the ministries of health, the different departments of the ministries of health. So how much more can they actually ask the private sector to collaborate if there is no interoperability even within the Ministry of Health? And if that was the current situation, then health information systems would be difficult to build, and you won't be able to see a comprehensive data about health in your country. So from there, a group of people banded together and called themselves the Asia eHealth Information Network. And from a group of 7 people from 6 countries, we have grown to more than 1,200 over the past 8 years, with representations not just from Asia, but also North America, Europe, and Africa. And I think the reason is the problem resonates with all of us, that we all aspire to have very good health information systems where any health stakeholder would have access to the right data at the right time. But in fact, uh, it is not really happening. It's very difficult, and the challenges are enormous. So, AeHIN, for the past 8 years, we've been meeting at least once a year with support from WHO, ADB, USAID, IDRC, GIZ, and because of this, and NORAD and other partners, and because of this, we've been able to grow the network and to refine our concepts. And we've summarized the challenges of health information systems at national scale in Asian countries. And we believe that four things need to happen for comprehensive health information systems to happen at national scale. First, there should be good governance, that there would be a public and private collaboration around the development of national health information systems. Second is architecture, that there should be a blueprint that the public and private sector understands, agrees, and shares, and commit to comply with, so that even as they each work on different parts of the healthcare system, they know that their individual separate parts can actually be interoperable later on when the reporting time comes. After that would be program management, that the stakeholders in the country, public and private, should have the ability to execute their part of the architecture or of the blueprint. And the last one is standards and interoperability, that the stakeholders, public and private, would be able to use the same standards that will be a prerequisite for their interoperability. And only then would be able to have comprehensive national health information systems. And we summarize that into what we call the Mind the Gaps framework, GAPS, representing governance, architecture, program management, and standards. So let me go back to our presentation and talk about OpenIMIS. And as we talk about OpenIMIS, perhaps simply as software, you will see later on that it's not just software, but actually a movement and a paradigm shift. So OpenIMIS is short for Open Insurance Management Information System. If you want to learn more at your own free time, you can go to openimis.org and read all about it. It's open source software that manages the interactions between patient, payers, and providers. This is in the context of a national health insurance system where there would be patients who are members of the insurance system, the payer who would be the manager, and healthcare providers who would then providing service to the patients, and the payer providing reimbursements to the provider. It's currently being used in Nepal right now and Tanzania. And three main proponents of this project are at the bottom: the Swiss Confederation, the Federal Ministry of Economic Cooperation and Development, and GIZ. And soon we will be expanding this in our meetings. We'll be adding AeHIN, we'll be adding GEMB, we'll be adding other partners who are participating in this project called the Community of Practice.